Hello, everyone. Welcome to today's webinar hosted by the American Public Human Services Association, otherwise known as APHSA, in partnership with the Public Consulting Group. Today's webinar topic is Child Care and TANF Administration Working in a Changing Landscape. Next slide, please. My name is Marie Camito, and I am a meeting planner at APHSA. I'd like to take a few moments to share a little bit about who we are and the work we're proud to do alongside our members. At APHSA, we represent human services agencies and leaders at the state and local level across the country. We're a bipartisan organization dedicated to building common ground and generating practical solutions that work for people and communities. Next slide, please. We aim to advance the well-being of individuals, families, and communities through three core channels: influencing modern approaches to sound policy, building the capacity of public agencies, and connecting leaders to accelerate learning and generate practical solutions. And our vision is thriving communities built on human potential. Next slide. And while we're on the topic of staying connected, I'd like to take a moment to remind everyone of our upcoming conferences for 2026. This year we'll be in San Diego, Arlington, Virginia, New Orleans, Spokane, Washington, and Salt Lake City. For more information on our conferences and to register, please visit the events page at aphsa.org. Next slide, please. APHSA also offers a career center. It's a dedicated job board and talent marketplace designed specifically to connect professionals with career opportunities across the human services sector. It provides a valuable resource for individuals seeking new roles, advancing their careers, or exploring other opportunities within the sector. Now, before I turn it over to our moderator, I'd like to take a moment to go over a couple of housekeeping items. You'll notice this webinar is being recorded. You will all receive the recording along with a copy of the slides in the coming days. And during this webinar, we're requesting that you use the Q&A feature to send your question to our presenters. The normal Zoom chat feature has been disabled for this session, so you really want to take advantage of that Q&A function. Our panelists will do their best to answer as many of your questions as possible live during the webinar, and we'll save some time at the end as well. Next slide, please. Now, with that being said, it is my pleasure to introduce the moderator of our webinar, Allison Comport, Senior Consultant at Public Consulting Group.
Thank you, Marie, and thank you everyone for joining today. As Marie said, my name is Allison Comport. I'm a senior consultant at Public Consulting Group. Those of you who aren't familiar with Public Consulting Group, we do public sector consulting. So for cities, counties, states, and basically if government does it, we do it. We're located in Boston, Massachusetts, and I'm excited to be joining you today. So first, I want to review the agenda. We're going to be doing a brief overview about what you can expect during today's webinar. We're going to be spending a little bit of time doing some grounding around some of the recent policy and system shifts. Next, we're going to be talking about some strategies and tools, and certainly our state panel will also be representing and speaking about strategies as well. And we look forward to hearing from them today. Next slide. So next, I want to review our objectives. The first is that we're going to discuss the current context on CCDF, PDG B5, and TANF. We're going to discuss strategies and opportunities to strengthen TANF and CCDF administration in alignment with current policies. We're going to learn about the activities of recent PDG B5 2026 awardees, and we're going to build a network of ideas and connections to support your public administration work. Next slide. So today I have joining me from Public Consulting Group my colleagues Deb Joffe, who's a manager, and Megan Smith, who's a consultant. So you'll be hearing from us today. Next slide. And we're also joined by our esteemed panel members, Michelle Height-Thomas, a Vice President at TCC Solutions, Adam Alston, a Director in the state of Indiana overseeing childcare, Nicole Rose and Tana Sen, both from Washington State. Nicole's an Assistant Secretary and Tana is Secretary, and we're really privileged to have their time and their expertise today. Next slide. So first, I want to ground us a little bit because a lot has happened over the last several months related to childcare, from the downsizing of federal staff, including the closure of several regional offices, to the proposed regulatory changes to CCDF, childcare in the media, and new and emerging trends in policy. During this webinar, there are several core messages that we hope that you walk away with today, and I'm going to kind of start with these. So first, we're in a current moment of some temporary flexibility in the federal regulations, and this is a great opportunity to begin thinking about utilizing this period to promote long-term stability and really set some action steps in place for states' goals. The next one is that program integrity is about more than system design, more about system design than it is prevention. Second is that TANF and CCDF alignment is really critical infrastructure, and we're going to hear more about that today. And lastly, states that align data, eligibility, and funding are better positioned for change and innovation. So we'll talk more about this. Next slide. So where are we now? Many of you are probably familiar with the Restoring Flexibility and the Child Care and Development Fund proposed rule, which was published January 5th, 2026. The comment period closed for this on February 4th, 2026, with over 12,000 comments received. ACF has confirmed that 51 state waiver requests were approved. And in August 2025, ACF formally announced that states may request additional waivers extending coverage through August 1st, 2028. As first 5 years fund data shows on the slide, states are currently almost evenly divided, with roughly half of providers being paid based on enrollment and the other half being paid on attendance. Every state, including the District of Columbia, has requested and received a waiver, delaying compliance with the 7% parent affordability cap. As a result, no state is currently out of compliance, even though their copay policies exceed 7%. This reflects the reality that states are making difficult policy choices based on their contexts and priorities. The proposed rule change would shift the decision back to states, and we anticipate receiving updates any day now. Next slide. Next, the topic of suspected child care fraud was cast into the national spotlight in December 2025. Since then, we've seen a rapid policy response across the country and have been tracking these developments, both at the federal level and within individual states. In just a few months, more than 8 bills have been introduced, and many states have begun reassessing their systems, controls, and oversight approaches for publicly funded childcare programs. What we're seeing is not a single policy response, but a range of strategies, legislative, administrative, and operational, all aimed at strengthening program integrity. Alongside these actions, Congress has also seen notable activity. In January, Senator John Cornyn of Texas introduced the Stop Fraud by Strengthening Oversight and More Accountability for Lying and Illegal Activity, or the Somalia Act. This bill would amend both the Child Care and Development Block Grant and the Immigration and Nationality Act to strengthen oversight of federal child care funds. It proposes strict penalties for providers found to have committed fraud, including permanent debarment from federally funded childcare programs, mandatory repayment of misused funds by states, and referrals to the Department of Justice for possible criminal prosecution. While we don't have time today to speak about all the states represented on this slide, we will highlight a few. Let's start with Ohio. Ohio lawmakers have introduced 2 bills, House Bill 647 and House Bill 649, that together would significantly revise how publicly funded childcare is administered and monitored. House Bill 647 focuses on program structure. It would update Ohio's publicly funded childcare program, strengthen provider standards and oversight, and align state budget provisions with these policy changes. House Bill 649 takes a more targeted approach. It would require licensed child care centers to install and maintain video surveillance systems in specific areas of their facilities. The intent is to verify attendance claims, deter fraudulent billing, and support investigations of misconduct. In parallel, Ohio's governor has issued an assurance letter to the federal government signaling the state's commitment to compliance and program integrity. In another example in Alaska, we can see that between 2023 and 2025, Alaska undertook a multi-year reform effort through the Governor's Task Force on Child Care, established under Administrative Order 346. That task force produced major reports in 2023 and 24 outlining 56 statewide recommendations focused on oversight, accountability, and infrastructure. Currently, the state is working to implement those recommendations, and in response, the Alaska Department of Health has launched a statewide digital childcare information system to improve provider oversight, track licensing and compliance, and modernize reporting workflows. They've also transitioned to a digital fingerprint check and implemented a range of regulatory and process changes aligned with the federal audit recommendations. Alabama's response looks somewhat different. At the state level, Alabama has launched a cross-sector task force charged with examining efficiencies across healthcare and education, including childcare. This effort is less about a single child care bill and more about system-wide oversight and accountability. While these approaches vary, the common thread is a renewed emphasis on program integrity, verification, and accountability in publicly funded programs. And you'll hear more from our panel members today about the proactive strategies that they've taken. Next slide. Next, let's talk a little bit about the federal budget. On February 3rd, President Trump signed into law most of the remaining fiscal year 2026 bills. Now we're looking ahead to FY27. What we know at this time is that the White House released President Trump's recommendations on discretionary funding levels. The budget includes level funding for the Child Care Development and Block Grant at $8.8 million and the Early Head Start program at $12.3 billion, as well as the elimination of the Preschool Development Grant Birth Through 5. Recently, President Trump also shared that more funding for these critical programs should be taken over by states. The statement connects to the work that many states are doing with analyzing and evaluating available funds and revenue streams to create dedicated funding streams. Another development that we're tracking is around the statement made recently by Alex Adams, the new Assistant Secretary for the Administration for Children and Families, who will likely be taking on deregulation for CCDBG and Head Start with the goal of returning the decisions back to states. He was quoted as saying regulation should, quote, fit on an index card in my back pocket, unquote. One of the things that we anticipate is that teacher ratios will be just one of the areas impacted, and we will closely watch these developments. The FY27 funding decisions related to these programs are in Congress's hands. Even in challenging budget years, we've consistently seen strong investment and commitment to early learning programs, and certainly hope that this will continue to be the case. Next slide. I want to spend a few minutes walking through how Congress is currently approaching childcare policy. The last couple of months highlight the importance of strong data, defensible systems, and proactive program integrity strategies. In January 2026, the House Education and Workforce Committee on Early Childhood, Elementary, and Secondary Education held a hearing focused on employer-supported childcare. Members from both parties discussed childcare in the context of workforce participation and economic stability. The hearing included testimony on employer-supported childcare initiatives and their interaction with existing federal programs, including CCDBG. The record reflects that employer-supported approaches were discussed as operating alongside CCDBG rather than as a replacement for publicly funded childcare. Congress has also considered legislation related to childcare provider access to financing through H.R. 7109, the Small Business Childcare Investment Act, which was introduced in January 2026. The bill would allow certain nonprofit childcare providers to participate in selected small business administration loan programs. These loans would be intended for capital purposes, such as facility expansion, renovation, and modernization. As of this time, the bill remains in committee and is not advanced further in the legislative process, but we will continue to watch it. Just this month, the House unanimously passed the bipartisan SEED Act, extending the educator expense tax deduction for the first time to early childhood educators so that they can deduct the cost of classroom supplies. The House also advanced a Farm Bill package that includes support for rural childcare, incorporating provisions of the bipartisan Expanding Childcare in Rural America Act to address the availability of quality and cost of childcare in rural communities. And we'll be hearing more about some of the great work that Adam has been doing in some of his rural communities. Several proposals introduced in Congress focused on the childcare workforce, particularly wages and retention. One example is the child care supply tax credit. This bill would provide tax credits tiered to worker compensation with higher credit amounts proposed for providers operating in rural areas. The aim is to address workforce challenges and child care availability. At the same time, the House has advanced multiple measures focused on oversight and program integrity with publicly funded childcare programs. In March 2026, the House Education and Workforce Committee passed several bills that would amend CCDBG. These measures address topics such as payment integrity, attendance and verification, audit follow-up, and clarification of statutory authorities related to fraud and noncompliance. 2 of these bills have passed out of committee with unanimous bipartisan support. Overall, congressional activity in 2026 reflects simultaneous attention to childcare access, provider capacity, workforce stability, and accountability. Next, I'm going to hand it over to my colleague Megan Smith to share with us more about the updates on the PDG B5 grants.
Thank you, Allison. Next slide. Across the 23 states awarded PDG B5 systems building grants in 2026, plans seem to be remarkably consistent. States are using PDG funds to fix coordination problems, modernize their systems, and strengthen oversight across birth to 5 services. The 2026 awardees are focusing on investments in clarity and coordination for these systems. Few examples include Delaware using its PDG B5 system building grant to modernize the state's early childhood data infrastructure and move from planning to execution. Vermont is designing a statewide coordinated intake and referral system, funding infant and toddler capacity grants, and conducting a comprehensive workforce analysis. Massachusetts is using their grant funding to strengthen cross-agency governance and data sharing across early childhood, education, and health agencies. In 2026, the state is implementing system-level coordination strategies within its mixed delivery early learning system and tracking progress through defined performance indicators. Also, Alaska is directing its PDG B5 funding toward building a shared statewide vision and improving coordination among child care, Head Start, home visiting, and pre-K programs. In 2026, the state is focused on family navigation improvements and long-term planning for early childhood system capacity in rural and remote communities. Now I'm going to hand it over to my colleague, Deb Jaffe, who's going to speak with us more about current policies and updates related to TANF and childcare.
Thanks so much, Megan. I appreciate it. Next slide, please. So I want to talk to you about some potential changes to the TANF program and how they might impact childcare. In early January, Senator John Husted from Ohio and Representative Blake Moore from Utah introduced the Upward Mobility Act of 2026. This bill would create a 5-year pilot program, allowing up to 5 states to blend funding from 10 federal programs into a single, more flexible funding stream. Programs included would span nutrition, housing, energy assistance, cash assistance, and childcare, including SNAP, TANF, CCDF, LIHEAP, and Section 8. The pilots would be overseen by HHS through the Administration for Children and Families with some guardrails. For example, funding would be capped at prior year spending levels, and only inflationary adjustments would be allowed. While this hasn't moved out of committee yet, the proposal reflects a growing shift in how policymakers are thinking about human services. States are no longer treating childcare as an add-on benefit. They're treating it as a core economic infrastructure. Childcare is increasingly recognized as something that supports work and workforce participation, enables economic mobility, and cushions the benefits cliff if provided as part of a transition off cash aid. And childcare, as we all know, stabilizes families and helps lessen the load on child welfare systems. One key takeaway from some of the recent discussion in Washington is that whether or not this pilot moves forward, the message is clear. Federal policymakers are signaling support for integration, flexibility, and system-level approaches. Next slide, please. As CCDF requirements evolve around payment methods, eligibility rules, and program integrity, TANF provides states with flexibility that CCDF doesn't always allow. Here's some of what we're seeing in the landscape. TANF dollars are often being used upstream to prevent disruptions before they become crises. States are funding the systems around childcare, technology, coordination, navigation, as well as the actual care itself. This alignment is especially powerful where child welfare, human services, and early learning agencies are coordinating expectations and outcomes. TANF is one of the few federal funding sources that states control enough to move quickly, and that can be incredibly valuable. Where coverage is limited, childcare gaps are often deeper. Where TANF is used strategically, states have more options to stabilize families. The opportunity is not just to spend TANF differently, but to align it intentionally with long-term childcare and workforce goals for the families they're served. I do want to stress that as you consider TANF as a viable funding source for childcare, it is important to understand the requirements that come along with paying for care with federal TANF or state TANF maintenance of effort dollars. These include confirming the family is eligible for TANF, knowing whether the parents are working or not, as that has implications for the family in terms of time on aid and how the states report the spending. With that, I'm going to turn it back over to Allison.
Thank you, Deb. And next slide. So now I'm excited for really kind of what's going to be the bulk of our time together, which is hearing from some of our esteemed experts about some of the great work that they've been doing in states. I've got a few questions that I've teed up for everybody that has informed what they're going to share today. So next slide. So first, we're going to be hearing from Adam Alson, who's the director at the Office of Early Childhood and Out-of-School Learning for the state of Indiana. He's got a really incredible and interesting background in terms of how he comes to this work. And there's a few things that I know that he definitely wants to share today, including some newly dedicated funding from the Financial Responsibility and Opportunity Growth Fund, or FROG as it's called in the state, a micro facility pilot that they're implementing, as well as their work increasing access in rural communities, and then how they're managing shifting financial and regulatory changes. So Adam, the questions that I have teed up for you, and I'll go ahead and I'll ask them and hand them over. So in recent weeks, Governor Mike Braun announced an investment of $200 million through the FROG Fund. If you could talk a little bit more about how that funding is going to be used and how it came to be. Next, and I'll ask all the questions and then put them in the chat as well.
Well, good. Okay, I was about ready to get ready on that first one, Allison, so.
The next is that you have some exciting childcare access and affordability initiatives underway, particularly in childcare deserts. So if you could talk a little bit more about that. And then also about some of the strong internal controls that your team has set up related to fraud reduction and risk mitigation, as well as some of the work that's continuing beyond your 2022 PDG B5 grant. So with that, we can stop sharing screen and I'll hand it over to Adam.
Yeah. Well, thanks, Allison. I think I'll probably start with the first question because I think it predicates especially the increased funding that the state of Indiana has put into childcare over the last month. I think obviously all of us that are on this call are well aware of the increased in Allison and at the beginning of this call was there's an increased interest and heightened emphasis on compliance, anti-fraud, mitigation, program integrity, whatever you want to call it. But I think at the end of the day, I think I was lucky enough in Indiana here to inherit a strong anti-fraud thought within the office here and that's only strengthened over the last 15 months. I think a very important piece that I think that anyone who is an administrator for CCDF can say like, hey, what are we doing internally, What's our internal culture, what is our goal, And very lucky that Indiana for years has been in a place where we can say like, hey, like we understand that the money that we have is scarce and the money that we has to get to the places that are doing things the right way, So that's families, that are doing things the right way. And that's childcare providers that are doing things the right way. Off the back of that as well, we've gone farther over the last year or so and continue to see can we improve our compliance and anti-fraud measures. One thing that we did very quickly off the back of the some of the news late last year around fraud in CCDF program is say, all right, can we be proactive? So, and one of the things that we worked through and we executed on behalf of the governor was saying, all right, let's go out and spot check all CCDF providers, right? Something very simple that takes some time and some coordination, but also to say, where are we right now, right? Can we spot check on where we are right now? And, we didn't find anything. And that doesn't mean that things don't exist, right? These are public programs. I think we all understand there will be some level of people that aren't doing things that we would hope they do with public dollars. But at the same time, there are things, very simple as saying, hey, how do we just go, does everybody have kids the way they say they should, right? And it's very simple, but it also can go a long way in saying, yeah, like we've done something, right? And we've done something that isn't just, right, it's not paper based. It's going and visiting the childcare base that we have in the state of Indiana. I think also on the backside of that as well, we as an office has instituted a compliance and anti-fraud team as well internally. So in Indiana, the CCDF and administrator, both, my office, the office I oversee, does both regulation of childcare. So does licensing for the 4,200 childcare providers, but also does the administration of funding as well. So, what that means from our perspective and is that we touch childcare providers in two different ways, right? We touch them on the regulatory side and on the licensing side, but we also have interactions with them on the subsidy side as well. And we're working, and it's an ongoing thing, but I think we've made a lot of good progress is how do we make both of those? How do we improve coordination internally as an office between both those two sides to strengthen, if somebody says something on the licensing side of things, right, that we're coordinating that as an office with the subsidy side and say, all right, is there something here or is there not, right? And also just strengthening those and developing those policies. To at the end of the day, effectively, like we've been in a place where, we've had scarce funding and every dollar that we have has to get to a family and has to get to, through a provider to, that is doing the things that we as a state want the funds to be used for. So predicated off the back of that, conversations, historical background here in Indiana is, in December in 24, we've had a freeze and a wait list on our major childcare voucher program. And, it was based off the back of we had a cash flow problem, right? And we had a very difficult choice to make. And it was saying, all right, do we fund children that are already on the program? Or do we cut reimbursement rates? Unfortunately, we went the cut reimbursement rates route. And, it's obviously been a challenge in the childcare space here in Indiana from both the supply side and the demand side, right? Especially for low income families over the last 15 months. And I will say that, I think, we had a session that started in, let's see, December. And, I think some of the challenges, and this is all coming off the federal COVID funding cliff, right? And I know other states have had these challenges as well. In Indiana here, I think there's been an acknowledgement in a lot more areas and in the state house to say, actually, this is people didn't know what they had until it was gone type idea. So, the idea, and what, out of conversations with legislators and advocates and the business community saying, hey, like actually this idea of childcare and funding childcare is actually very important. And, so out of that came some legislation that allowed for for Governor Braun to propose to our state budget committee to say to put additional funding into our voucher program or our CCDF voucher program. In the colloquial, the name of the fund is the Financial Responsibility and Opportunity Growth Fund or FROG Fund. But what that effectively was a mechanism in a non-budget year for us is to increase funding into childcare. And we're going to use that through, that was passed and, we were able to, get that passed with our partners in the General Assembly. And that will increase our baseline enrollment from 43,000 to 57,000. It is a 1 year worth of funding, but part of the conversation that we're having as well is also the understanding that, CCDF vouchers are not something that are, these short-term. It's not a short-term thing, right? It's in Indiana, our average life of our voucher is roughly 2.5 years. So, part of the conversation is not just 1 year short-term or stopgap funding, but is this the beginning? Then it should be the beginning of longer and sustained investment in the childcare space. For context around what that $200 million means, right? That's a 500% increase over historical state investment in childcare. Historically, the state appropriation has been the amount that allows us to pull down the maximum amount of CCDF funding. In Indiana, to the TANF point, Indiana historically for a long time, and for many, many years, has also put 30% of TANF funds, has transferred 30% of TANF funds into childcare vouchers as well, right? So we're in a space in a state that does understand the importance of childcare broadly, right? And has done some things, and now this is the next part of it. That 200, so effectively we're what for our low income voucher program, it effectively ends up being 1% of our state budget, and that I think that's a substantial shift around how broadly how we as a state have looked at it. And it's some in Allison, it may have been you that mentioned it earlier, is like it's the the tack that we're taking, and I think it's a very good one, and it's one that aligns with many other things that happen in conversations that are in the ether right now, is that right childcare is a part of the whole gamut of things that that states and federal government does in order to, people that want to better their conditions, how can we help them, right? And childcare is an important part of that, and it's a piece that probably has been, for better or worse, for whatever reasons, right, is kind of fallen off and is part of that conversation. And then here in Indiana, I think it's coming to the fore again. Regarding some of the other things we're doing as well. However, that $200 million sounds like a lot, and 1% of state budget and all this, right? Sounds like a lot, but however, effectively what that does is it gets us to a status quo point from about 18 months ago of where we are in a state, and from CCDF, from a demand side with CCDF enrollment, but also from a supply side as well. That gets us to about where we were 18 months ago. So, the real broader questions around childcare in Indiana still exist, like they do in many states, right? It's twofold. On the demand side, it's costs too much, and on the demand side, there isn't enough of it, right? So, there's, and we all know here, but I'll say it is like, in Indiana, our voucher program only goes up to 135% of FPL. So, you're looking at, there's a pretty substantial benefit cliff, right? And and so we're addressing affordability for childcare for one part of the income distribution, but we're not touching it all. So that's the demand side. I think there's more work to do there in Indiana and come up with creative policies, that in order to address that. But on the supply side, I think there's also some work and some opportunities there as well. I'm going to say regulatory modernization, which hopefully no one gets sad about that. When we say that, and I say that in Indiana here, our regs haven't been looked at in 30 years, which means from my perspective, it's twofold. One, we have administrative things on the books that cost money to providers every day and take time away from doing the real work of caring for kids and educating kids, and say, well, we want you as the state of Indiana to go, fill out some papers for us, right? So we can check a box that we have to. I think there's an opportunity here in Indiana, and we're working through this on the administrative code side to say, like, how do we make this better and better from the provider's perspective, right? Health and safety is obviously the focus of anything we're going to do in this space. And, and I take an optimistic tack of the space itself that, if we haven't looked at the regs in 25 or 30 years as a state, well, we have 25 or 30 years worth of the childcare space and the early childhood space has advanced dramatically in the last 25 or 30 years as well. And how do we become better aligned with what we require, and also the professionalism within the space itself, that has dramatically increased since we as a state have looked at our regulations. The other side of that as well is saying, it's not, regulations is also not just, ratios, right? That's obviously a very important one. But a thing that we're starting to think about as well and look at is regulation as business model as regulation. So in Indiana, our regulations from both an administrative and a statutory code side effectively make the business model from the supply side be one of effectively three things, right? You have to be a child care center, you have to be a child care home, and we have registered ministries, which is, think of it as like a center. But effectively, what that means is childcare from a business model perspective and a supply perspective, has to be one of those three things. And, so I think there's opportunities that we can, as the state of Indiana, from a regulatory perspective, say, how do we increase the potential business models that can exist in this space? And to that end, in the state here, we've had a pilot program for microfacility, which, I know that's being happening in various places in the country. We've had a pilot program, that was extended for another year. Think of it as a hub and spoke model. It's very similar to a shared services model, but instead of having the space create that, we put it as an auspice. So to give kind of some more validity, probably, to the childcare space, to say, like, this is something that is possible to do. Ideas put all the administrative and oversight in one place, and the actual care happens in place, in smaller places up to 30 kids, away from where the administrative side happens. And I think there's some opportunities that once, if that gets passed as an auspice next session, to say there's a real great way of increasing, supply in places that we have childcare deserts now, whether that's rural right? That's rural areas. I live in a rural community halfway between Chicago and Indianapolis, but it also means, I think it's not just that, though. It can also be, for effectively any area where that can't support from a per capita income perspective, that incomes aren't high enough to support a center, right? Like, it gives another option. And it also gives them options, I think, for employers as well to get in the space, and also, potentially school corps as well here in Indiana, of like, they got a classroom, right? Can they convert the classroom or a couple classrooms, micro facilities? So, a lot of, I think there's more work to do, obviously. Increased funding only goes so far, right? And I think, whether it's in Indiana or any other state, it has to be paired with some, how do we make it easier for the things, how do we make it easier for the whole space and the whole system to do the things that, we want it to do, which is, provide excellent, right, have kids have the greatest start as they can between the ages of 0 and 5. So I think I answered most of them, Allison, but I'll leave it there unless there's something else you'd like to ask me.
Thank you. Can you just share real quickly before we transition and move on to Washington, because I think it's really interesting for a little bit about just briefly your background and kind of how you came to this, because I think that the program that you set up in partnership with the healthcare facility is also a really interesting example of community building.
Yeah. So my background. So I originally was a farmer in Rensselaer, Indiana, corn soybean farmer, third generation. Off the back of that, I lived in New York as a bond trader beforehand. After college, moved back to Indiana, took over the family farm because I was like, I'm tired of New York. If anybody's here on New York, I loved it when I was there, but didn't want to raise kids there. So, off the back of that, I come to this space from a community development bent, and childcare. Effectively, there was no licensed childcare facilities in my town of about 5,000 people, and myself and a handful of other people in the community created a nonprofit called Appleseed Childhood Education to create affordable and quality childcare in a rural community, and we were able to pull that off. We created a center that opened up in 23 that, in partnership with, our local critical access hospital and regional healthcare provider, Franciscan Health, but also with employers as well. So we got employer buy-in, but also local government buy-in as well to fund both the building of it, but also for ongoing operations as well. And, And I think the concept and the idea is that, from my side is like, this is really hard to do. Like, to do it in Indiana, to do what we did is very hard to do. And, in Indiana, we're very lucky that there's innovation that's happening in this space all the time, or whether it's the community side, whether it's the for-profit side, whether it's, whatever it is, like the employer side, right? Whatever it is, like, there is so much great things that are happening here. And the next step, I think, here in Indiana is how can the state of Indiana create policies and funding streams to support the already great work that's happening on the ground throughout Indiana.
Thank you very much. I appreciate you sharing that.
You're welcome.
Additions. So we can bring the slides back up. And next, I'm going to hand it over to Nicole and Tana, who are going to share with us some examples from Washington. So for the sake of time, I'm going to kind of ask all of the questions up front and then hand over the mic to them. So Washington has long implemented child care fraud strategies, and they're going to be talking about that today. So if you could share with us specifically around your accountability systems, what you've done, the impact that it's had, lessons that you've learned, things you wish you knew when you started, and how have these supports put you in a position for the current context? How are they really set you up to be positioned well? Also, if you could talk a little bit more about the policy approaches that you've established over the years, from the Early Start Act to the Fair Start Kids Act, that have also supported your system's work. So, Tana and Nicole, hand it over to you.
Thanks so much, Allison, and thank you to the APHSA for inviting us today. My name is Tana Sen, and I am the Secretary of the Department of Children, Youth, and Families in Washington State. And we have all of early learning, child welfare, and juvenile rehabilitation under our roof. And I am a former state legislator. And so I bring both the policy and the implementation hat to this work. And in fact, I was the author of the Fair Start for Kids Act that Allison mentioned, that really helped set up a very strong framework for childcare across our state that was based on a lot of input from providers, from the business community, from parents, from teachers, and we have quite a robust early learning system in Washington State that I'm very thrilled about and proud of. And I will say, coming to DCYF from being a state legislator, I recognize that there are things that as our legislators don't potentially understand on the implementation side. And so as we talk about a lot of the work that is going on in this space, I think it's important to remember that every time we do change policy, that impacts the implementation, of course. And when we talk about accountability and we expect IT systems to work or to be necessary for an accountability item, that takes additional resources and that takes time to implement. And none of those things are free or readily available. And so I think there's really that balance of where are we putting critical resources, making sure kids are getting access to childcare and the government money is spent responsibly. But I think it's important for us to continuously talk about the balance there, that we want to make sure that we aren't taking away the important funding for the actual service just to spend more on over monitoring. But again, financial responsibility is of course very important. So we in Washington have really looked at the importance of quality, the importance of access, the importance of affordability, and all of that, the interplay in there. So I'm going to turn it over to Nicole, who's going to talk a lot more about our systems that we have in place that really came in this organized manner, frankly, because after Minnesota, I think Washington was got the most attention on how are we doing with fraud or our auditing systems. And I think what we really uncovered was that we have a pretty robust system, and I'm really proud of that. Of course, there's always room for improvement, but we are pleased that we've been working closely with our childcare providers, educating now our state legislator legislators and others about what we do, and making sure that there's also that clarity that there is that these are small businesses that are doing the work of childcare, and business is not necessarily at the top of mind. And we in government make mistakes sometimes too. And so just really emphasizing that overpayments or missing documentation does not equal fraud. And so just making sure that we are constantly balancing the provision of the service and the fiscal accountability. So I'll go ahead and turn this over to Nicole.
Thanks, Secretary Sen. So if we want to go to the next slide, and I'm Nicole Rose. I'm the Assistant Secretary of Early Learning at DCYF, and you're going to hear me talk a little bit about subsidy, and I'm going to talk about licensing as well as part of our monitoring and oversight. And we do have another colleague who oversees that program. But just for some context, just want to talk a little bit about the size of the Working Connections Child Care Program and the number of licensed providers and license exempt providers we have in our state. So when we think about child care subsidy in Washington State, we have state and federal funds that are going towards that, with an expenditure of over $927 million a year. And we have seen over the last several years growth not only in the number of families that are eligible. You'll see in calendar year 2025, we had over 63,000 families that were determined eligible, but we're also seeing a growth in our child care provider community. So we have over 6,600 licensed child care providers, centers, and homes. And then we also have license exempt family, friend, and neighbor providers in Washington State that accept subsidy, and we have over 2,200 providers. You want to go to the next slide. When we think about Working Connections, subsidy eligibility, and accountability, I think one of the things that we really want to remind folks of is that Working Connections and child care subsidy starts with family eligibility. And we know that families are eligible. And once they are determined eligible, that is when they go and they find a licensed child care provider. And that child care provider is identified. And then we do an authorization, so that provider can be paid. Once that family is eligible, they find that licensed provider and the services are provided, then payment is made available. So it all starts with that family eligibility. That's that first sort of safeguard. And I'll talk a little bit more in a moment about some of the audits that we do on family eligibility. So now we have a child who is in a licensed setting. And so if we go to the next slide, I want to talk a little bit about our licensed provider monitoring and oversight. So as I said, we have a team of licensors that go out and they are inspecting childcare programs. They are doing 100% of their monitoring visits. They go and see every single licensed childcare provider, and they are doing unannounced visits. They're doing that at least once annually. And then they're also following up on any complaints that come up. If they're going out and maybe they had a concern about the number of children that were there, they're going to talk with our child care subsidy team about that. Likewise, when our child care subsidy team is doing audits on provider payments and we might have some questions, we're going to talk with our licensing team about that. So DCYF is looking at eligibility and licensing, but there are a couple of other things when we think about sort of monitoring and how we know what's happening about the great care that's going on in our provider community that I think are important. In Washington State, we have Early Achievers. That's our quality rating and improvement system. And we have coaches that are going on site and providing technical support and assistance to providers. And if providers are participating in the child and adult care food program, they're also receiving some monitoring and oversight there as well. If we want to go to the next slide, as Tana talked about, overpayment does not equal fraud. And this really is helping to show kind of the funnel, kind of looking at when we're doing audits on our providers and on our families, the number of audits that occur, going down to the number of cases that may be referred to the Office of Fraud and Accountability. At DCYF, we have 6 centralized auditors for provider payments and 6 centralized auditors for family payments. But what you can see is on both of those things, we're auditing about 23% of our providers and our families. And we have a very small percentage, 0.1% of provider payments that are referred to the Department of Social and Health Services, Office of Fraud and Accountability, and a small percentage that are referred on the family side as well. So again, there are many safeguards that are in place as we're looking at starting with family eligibility and going through our process and providing technical assistance and support to providers. If we want to go to the next slide, Tana talked a little bit about this earlier. One of the things that we really have to make sure of is that we're finding a balance between making sure that there's monitoring, accountability, and oversight, and that we can maintain equal access to care. And there are some things I think that have happened in Washington State to really help us do that. And if we want to go to the next slide, I think some of the things that we have really looked at are quality, workforce, accessibility, and affordability. So I talked a bit about that quality piece, really focusing in on the supports that are invested in early achievers to make sure that providers are providing that high quality care. We continue to connect with our workforce and talk about the qualifications and the multiple pathways for providers to meet those qualifications. And then accessibility and affordability. And I heard Adam talk a bit about this as well, right? So one of the things that we know around accessibility is sometimes the rates that we're paying providers. And we have seen consistent investment in rates. In Washington State, you really saw that with the Fair Start for Kids Act. And then family affordability is another lever that we look at here. And so part of that means we have to look at who is eligible for childcare. And right now in Washington State, for a family of 3, they can make up to about $70,000 a year. So on the next slide, you'll see some of the things that have been successes and some of the things that we're talking about moving forward. I heard Allison talk about the Early Start Act that was back in 2015, and that's where we really saw 12-month eligibility and a really big focus on continuity of care. And when we went to the Fair Start for Kids Act, we really started to see our access to care increasing. We made that shift to state median income from federal poverty level. And there was a commitment to continue to invest in child care provider rates, knowing that if those rates were right, that more providers would be able to accept subsidy. It's also really important to support new providers who are coming into the field. And we do that in a couple of different ways through our Imagine University, who does mentoring, and then a pre-licensing unit. Providers go into this business often because they want to care for children, not because they want to set up a business and run a business. And so we have a pre-licensing unit that helps them navigate getting started. And then we do really want providers focused in on providing that care on a daily basis. And so as we go out and do our monitoring visits, we have implemented some streamlined checklists so that we're really focusing on the things that matter during that time. And then on the state-funded preschool side, we've had some significant investment recently in our early childhood education and assistance program, because we know it's access to care, to preschool, before and after school care, all of those things that make up that mixed delivery system that make it really important for our providers and for our families to be able to have equal access and to make the choices that they want and the care they want to have their children in. Tana?
Yeah, so I was going to say, because Adam brought it up, we also have started a few years ago what we call the Early Learning Facilities Fund, that both childcare and schools can apply for some capital dollars to build or expand or update their facilities, as long as it is increasing access to our working connections childcare slots. And that has been a critical lifeline, especially in rural communities, in our underserved communities, our childcare deserts, to really being providing that capital dollars so that there's the possibility to have childcare in those areas. And so that's been another key component of our success, I think, in childcare.
Okay, well, thank you both. I think that we can go to the next slide. And And then let's see, we can go to the next one. I want to hand it over to our final panelist is going to be Michelle Height-Thomas, one of our partners and colleagues at TCC Solutions, and she's going to be sharing with us a few resources. So some of the questions that I've teed up for Michelle, which I'll kind of ask all at the beginning, is that TCC recently released a new report titled Strengthening CCDF Program Integrity, a Practical Framework for States. If you could share with us some of the main ideas of the report, the components of the framework, that would be great. And then share some examples of ways that maybe states have been, implementing this document as well. And I'll hand it over to Michelle.
Great, thanks. Hi, I'm Michelle Height-Thomas, and I am a former state child care administrator in a state that did have a very large TANF transfer every year, and that continues to be the case. I am currently at TCC Solutions, where I've been for the last 10 years. I'm a subject matter expert inside an IT company, so what that means is I get to tell coders all of my ideas about what we should do next, so they're always very excited about that. Let's go ahead and go to the next slide. All right, so what is program integrity? As Allison mentioned in our recent white paper, we frame program integrity as mattering for four interconnected reasons. So first, fiscal stewardship, and I think we've heard some examples of that and why that's so important. Improper payments, whether they're from eligibility errors, documentation errors, or outright fraud. They drain limited resources that should be going to kids and families. So when we talk about program integrity, what we're talking about is how those assistance programs are managed day to day. And we specifically wrote about CCDF, but it's applicable to all program administration, whether it's CCDF, TANF, Medicaid, food stamps, SNAP. It's the systems, processes, and controls in place to help ensure the program is run accurately, fairly, and in line with those federal and state requirements that are so important to meet. And it covers a wide range of issues, and I think we've touched on this as well. On the one end, it can be unintentional errors, things like data entry mistakes, missing documentation, or just general misunderstandings of policy. And on the other end, it includes intentional violations, such as misrepresenting eligibility, falsifying documentations, or outright fraud. At its core, program integrity is foundational to effective program administration. Next slide, please. So I was starting to mention that, it's important for four interconnected reasons. One is around fiscal stewardship. And then, of course, public trust. It follows on that. Consistent, transparent oversight builds confidence with your families, providers, and policymakers alike. When the program works with integrity, people believe in it. And then we've also touched on provider confidence. And while it may sound odd to say providers develop more confidence in the program, the more that you're holding them accountable may seem disconnected. It's fair and clear oversight and policy and training that really can support provider participation. My personal worldview is that most providers and people want to do the right thing. And when they have clear guidelines and understanding of how to operationalize those, it increases their participation and their confidence. And then lastly, equity and access ties it all together. The whole point is making sure that the assistance reaches the right children and families who actually need it. The key framing on the bottom of this slide is also really important to note. It's not just a program or a policy office responsibility to implement program integrity. It's a whole agency-wide enterprise effort. So policy, operations, finance, audit, legal, and IT all have a role to play. Next slide. And no single tool or checklist is going to get you to strong program integrity. It actually takes a coordinated framework, one that deliberately aligns our people, process, and technology. And that's what you'll find in the framework of the white paper we referred to. We want to make sure that all three of those things are working together, not in silos. So let's take just a moment to think about each of the pillars. People means having the right expertise in the right roles. CCDF policy experts, data analysts, monitoring staff, finance, and audit all need cross-agency coordination. So a good example just came up to Adam's point, talking about that cooperation and collaboration between licensing and subsidy. There was a recent study that was just done on child care licensing where it pointed out 20 states are still solely relying on manual communication between one person to another to let the subsidy agency know when an action's been taken on a license, which ultimately typically affects their eligibility. I was stunned to hear that it's 20 states that are still relying on some kind of manual coordination. But those people are important in coordinating that. Process is your systemic approach to finding and responding to the risk in your program. And these processes can include things like structured risk assessments, red flag, or QA reporting, eligibility case audits, and attendance and payment reviews. And without documented, repeatable processes, even your experienced staff can miss patterns or produce inconsistent results. And while I may be biased because I work for a technology company, I think technology is what helps make all of those things scalable. So electronic time and attendance, real-time data interfaces, optical character recognition, document scanning, and AI-assisted anomaly detection. These are all tools that can reduce manual workload and catch things humans simply can't catch at volume and scale. So the bottom line is none of these three will work well in isolation, and the framework we propose holds true when all these three are aligned. And then lastly, I know we're out of time. I will just, if you want to switch to the next slide, TCC has developed an online free tool. You need only an email to access it. We have designed a set of 32 capability statements structured across our framework of people, process, and technology. As you go through and complete the process, you are provided with a results and summary. The most important part about this online tool is not the checklist that you go through and get a result from. It's the conversation that happens when you have agency partners and staff each take the online tool and compare notes and start to see where you're aligned and where more conversations need to happen. I'll stop there.
Thank you so much, Michelle, and thank you to our wonderful panel. You all have shared some really excellent state examples and resources. So I'm going to go ahead and wrap us up. If we could go to the next slide. Those of you who are on with us, feel free to use the Q&A function to post any questions. We'll stay on and answer those. And then I also posted a link to the framework also in the Q&A. So next slide. Okay, so just to wrap us up, positioning for long-term success under temporary flexibilities requires using those flexibilities intentionally. Waivers are helpful in deciding how to strategically use this time to meet necessary requirements. And as you can see, states that are using this period strategically are focusing on alignment across funding, systems, and programs, guided by a clear roadmap that links today's flexibilities with longer-term goals, such as stabilizing provider payments, reducing churn, strengthening monitoring, and improving transparency for families. Many states are starting by mapping all available funding, CCDF, TANF, PDG B5, state and local dollars, to identify where flexibilities exist and how funds can be braided and blended rather than used in isolation. TANF in particular is increasingly being used alongside CCDF as a strategic tool to stabilize access, support system modernization, and buffer families and providers during transitions. Strong data is essential to ensure TANF adds value without creating unintended consequences for families. At the same time, states are using program integrity tools as drivers of efficiency, not just as compliance. Investments in real-time data, automated checks, cross-program verification, and aligned eligibility and redetermination timelines reduce administrative burden, prevent improper payments, minimize paperwork, and improve continuity of care. Cross-agency coordination, drawing on data from programs like SNAP and Medicaid, unemployment insurance, shorten processing times, reduces errors, and lowers barriers for families. Together, eligibility alignment, data modernization, and prevention-focused integrity create an infrastructure needed to support innovation, including alternative care models such as TriShare, shared service cooperatives, and employer-partnered childcare. Temporary flexibilities give states room to test and scale these models while maintaining accountability through modernizing monitoring systems. PDG resources have and continue to be a helpful resource during this time. Several states show us what this looks like in practice, as you heard from today. Additionally, Rhode Island and Oregon have leveraged cross-agency data sharing to automatically confirm eligibility, reduce paperwork, and lower caseworker workload. And Colorado has intentionally braided early learning, childcare, and TANF resources through a statewide pre-K alignment effort, focusing on where the state has control and how guidance, monitoring, and accountability can support local implementation. Ultimately, sustained data collection underpins all of this work, helping states to understand what relies on waivers, monitor readiness, manage risk, and plan for what comes next, whether compliance resumes sooner or later. The goal is not simply returning to compliance, but building simpler, more durable systems that continue to work for families, providers, and staff. Next slide. And next slide. So as I wrap this up, we have two QR codes that we're going to be sharing with you. The first is a closing survey. If you guys could use your phones and just scan over that QR code, and at some point today complete. We just have these two questions. What did you find most valuable and or interesting from today's webinar? That will help us to be able to inform additional events and engagements. And what would you like to learn more about or continue to discuss? And then I'll give one more second here for you to scan over that QR code. And then we have, let's see, next slide. One additional QR code. If you'd like to receive additional emails regarding the support and services that Public Consulting Group can offer, please feel free to scan over this QR code, and we're happy to connect with you after this webinar. And then last but not least, next slide, I also wanted to provide all of our contact information for today's panelists and presenters. And so you can find all of our contact information here. We encourage you to find us on LinkedIn, reach out, don't be strangers. And we thank you so much for your time today. And let me see, I just want to see if there's any more questions. All right, it looks like we've answered all of the questions that have come into the chat. So thank you again for our esteemed panel, for everyone's time today, and we hope that you have a wonderful afternoon.